The following is an Operation Podcast production.
I've actually fixed more people's sleep with this one tip than any other single tip out there. Period. Full stop.
You've been talking about this for a minute.
25 years.
25 years as a personal, huge sleep health advocate and professionally.
Yes.
What has been the biggest consistent through line that is accurate?
Easiest one. If every one of your listeners did was do that, I can guarantee a 20 to 30% improvement in their overall sleep quality.
Wow.
This is one of the best questions I've ever been asked when it comes to circadian rhythms.
All right.
So I like where your head is at. So, hey everyone, this is Dr. Michael Breus. I'm known as the Sleep Doctor, and I'm pretty stoked to be here on Everforward to talk about sleep with you.
Yeah, so episode, 24? Episode
24.
24. So from episode 24, July 2017. To now, April 2025.
Yep.
Great to finally sit down with you in person.
I know, I'm excited.
Yeah, welcome to be here, Dr. Michael Breus.
Thanks for having me.
The Sleep Doctor.
That's me.
Sleep is one of my favorite things in the world.
Me too.
But that's why we're here. I got to ask, as a new dad, this is my chance to be selfish.
You're going to be crushed. How old is your baby?
10 weeks this Thursday.
Oh, congratulations.
A newborn.
That's
So,
amazing.
I love him, Baby Dean. Shout out, Baby Dean. We're in a much better
Love you,
place
Baby
now.
Dean.
But I know I'm not alone.
No,
New parents.
you are not. So the data would suggest that new parents, specifically the first year, actually the first 3 years, you lose almost, I think it's like 7 months of sleep. Like 24 hours, like if you just collected it all within 3.
Over the course of the year.
Over the course of 3 years, you're losing roughly 7 months of sleep. I think that's the right data.
My heart. Oh my God.
Well, no. There's an easy way out of it, right? So I don't know what you and your partner are doing, but what I recommend, very first shot out of the gate, an on-call system, right? So doctors do this all the time. So when you're a group of doctors and you have to cover the hospital, one guy stays up all night and covers for the other 4 guys and gals, right? Same process, except for you only have one person that can cover for you. So Monday, Wednesday, Friday, you take the baby. If the baby Dean wakes up, Tuesday, Thursday, Saturday, your partner takes the baby. If the baby wakes up, you flip a coin for Sundays.
Okay.
And that way, you know that you're going to get at least 3 decent nights of sleep in a week, and so is your partner. The problem, what a lot of people do is they'll say, I'll take Monday through Wednesday, you take Thursday through Saturday, and by the time Wednesday hits, you're so exhausted, you get crushed.
Can't just group them together, they need to be broken up.
Every other day is really the best way to go about doing what I call the on-call system. Now, there's a second system that you can utilize depending upon your chronotype. So we talked about chronotypes last time. As you may remember, I'm a night owl, or what I call a wolf. Now, here's the good news. If you happen to have a partner who's an early bird, like a lion.
That's me.
And your partner is a wolf, what you can do is you can just split the night in half. So if I'm already going to be up until 12:30, 1 o'clock in the morning, staying up and covering the kid until 2 or 3 is probably not the worst scenario for me, versus my partner, who might be an early bird, can wake up at 4:30, no problem, and probably does on the regular, so that person can cover the second half of the night.
This is great information because actually I've been running this kind of A/B test recently. So my wife is on maternity leave now.
For how much longer?
Well, we're extending another month. So she's got 2 more months.
Nice.
Yeah. So what we've been doing recently now, because he's getting into longer and longer bouts of sleep, 4 to actually last night he did almost 6 hours.
Oh, it's awesome.
So what we've been doing is like, I'll take the first wake up and feeding, and then she'll do the second one. And then I'll do typically the third one, which is when I would just wake up normally anyways. Perfect. But based on qualitative data, how I feel, and quantitative, looking at my Whoop data, I am seeing that it's actually not working out to my favor. So I'm actually getting total about the same, 8 hours sleep, but it's more broken up. And I think it's because of my chronotype. So what I'm hearing is, I think, because my wife, she'll stay up way longer than me. I'm up by like 5:30 a.m.
Yeah, let her take.
We should switch those.
Yeah, exactly. Follow your chronotype. You'll be surprised at how well it works. And it might not be perfect. Like you might still need to do a little bit of the Monday, Wednesday, Friday thing, on occasion. But between the two of you, you can probably figure out a schedule that makes a little bit more sense for you.
Okay. Do babies have circadian rhythms?
Depends on their age.
Okay. Or is it how we parent them that develops them?
Both. So great. This is one of the best questions I've ever been asked when it comes to circadian rhythms.
All right.
So I like where your head is at. So interestingly, when you have a very, very young new baby, believe it or not, they enter sleep through REM, and they only have 2 stages of sleep. It's like a REM or a non-REM. We actually call it something different. We call it something called trace alternate, and there's another form of type of EEG waveform. But basically, infants, itty bitty, teeny tiny, the squishy ones, the raisins, they really either are in deep REM or they're in regular old sleep. And then not until they hit I think it's 3 or 4 months do we start to see the formation of new and different stages of sleep in terms of the depth and being able to look at the differences of the depth. Remember,
is that just because of brain development of where they're at?
Exactly.
It actually doesn't get into those different waves?
So here's what ends up happening is the way we measure sleep is based on EEG brain waves, right? When you've got an itty bitty teeny tiny, they don't have brain waves yet, or at least not the brain waves like we're used to looking at when we identify sleep. They have a different kind of brain wave, but they're going to catch up and they're going to get there. It just takes them a little while to get there. So what ends up happening is you start to see what are called sleep regressions, right? So as an example, here's what's going to happen.
I've experienced that. It's horrible. It's horrible.
Exactly. So you go through a period of time where there's brain development and then all of a sudden it's a new kid and it's a new sleep pattern and you better get used to it because it's happened and there's no turning back. And then it gets better. And then around 2 years, it hits you again. So there's a couple of different times where you're going to see this regression back to messed up sleep, waking up multiple times throughout the night, things of that nature. And it doesn't just have to do with brain development, it has to do with entire body development. So half the time kids are waking up because they're hungry, right? Their body is growing and they need more food, especially kids who are mostly breast milk fed, because what ends up happening is they burn through the breast milk like quick. So
faster than formula?
Yes, absolutely.
Why is that?
Because it's easier to absorb and it's easier to digest.
Oh, okay.
So it rips through. It's about the most natural substance on earth for babies.
So it's just extremely bioavailable.
Correct.
There's hardly any digestion, metabolism that actually needs to happen.
Right. Okay. And what ends up happening is the kid burns through it because yes, it's calorically dense and it's got some fat in it, but it's not a carbohydrate. I mean, there is carbohydrates in it, don't get me wrong, but it's not like carbohydrates like we think of carbohydrates. So as an example, when I've got a parent who's like, hey, I've got a 12-week-old or a 16-week-old or, even let's say a 6-month-old and we're having some sleep related issues, like the baby seems to be waking up after 3 hours and we can't settle him back down. We have to give him a bottle. First thing I usually recommend is put a little cereal in the breast milk before bed and thicken it up a little bit so that the baby's got a little more substance in their stomach.
We talking Golden Grams? We talking Cheerios?
We're there's a flaky oatmeal substance called cereal that you can find in the grocery store aisle. It looks like an oatmeal, but it's super flaky. It's very thin. Your partner, if they do the grocery shopping, will know exactly what I'm talking about. And you just pour a teaspoon of that in with the breast milk, let it dissolve in. It just thickens it up a bit. Okay. You may even have to create a slightly larger hole in the nipple for the substance to get through. But once it gets through, it fills up their belly and now they're nice and happy and then they have a tendency to sleep.
My wife is going to love me when I come home with all these new tips. That's incredible. I feel like I just got a crash course in sleep health. You just condensed probably like 2 months of self-research into 7 minutes here? I don't know.
Yeah, that's what I do.
Yeah. Okay, so one other question around new parent and baby sleep health.
Yep.
What is, and I hate to say worst thing here really when we're talking health, but what is the worst thing a new parent could do in terms of their baby's sleep?
Oh, that's easy. The worst thing that parents can do is in terms of their baby sleep. Well, there's 2 things. Number one is leaving them in their own bed with them too long. A lot of parents like
too long,
like months and months and months. So So when
you're talking co-sleeping,
correct, right? So if it gets in there too long, that can be problematic because the baby loves it. Like, why wouldn't they? They get to hang out with their parents. It's warm. It smells good. There's a food source right next to them. Like, if you get them too used to that, they're not going to want to leave.
So, but you're not saying co-sleeping is detrimental in short bouts
First
and
12,
timeline
first 12
for the
weeks,
child. Okay.
I got no problems with co-sleeping. But what I will tell you is from a co-sleeping perspective, you want to have some type of apparatus that the child is in, like a basket, like a Moses basket or something like that. As long as there's something there, the problem is what you don't want is you don't want the adult human to roll over on top of child.
Of course. Yeah.
Right? And that only usually happens if alcohol is involved. So parents are not to be drinking and sleeping in the same bed because they won't recognize waking up and they end up smothering or
any
crushing.
substance, really, probably. Yeah.
Any substance is probably a bad idea. The second big problem that I think a lot of parents do is they put the child down asleep. This is about the worst idea you could possibly have because the child has no idea how to self-soothe. So here's what's interesting is there's this concept called object permanence, which is it happens at a particular time in a child's life where when you leave the room until they understand what object permanence is, they think you've left them forever. And it's pretty scary when you're this little, entity and you have no idea what's going on. And so what you want to do is put them in the room awake, because if you put them down asleep and they wake up, which they inevitably will do, they're going to be like, there. Where's mom? Yeah. Where's dad? Yeah. And they're going to let loose versus, oh, I've been here before. I know mom and dad are around. Or if I start crying, mom and dad can walk into the room, not touching the child, but letting the child see them there, calming the child down with their words, not their hands, and allowing the child to self-soothe themselves back to sleep. Now, I want to be clear. If the child's got gastroesophageal reflux, if you've got a special needs child, if you've got a child's got a cold, got something going on, clearly pick up your kid, right? But if your kid's in great health and all they're doing is waking up and crying, you need to resist the urge to scoop them up and cuddle them until they fall asleep and then put them back down to sleep because they never learn how to sleep.
Okay.
So now, you shouldn't allow the child to just cry and cry and cry and cry. I'm not a big fan of the cry it out method because, quite frankly, a lot of parents don't know when to pull the plug, right? And they'll just let them cry, 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 and all of a sudden the kid pukes, right? Now you've got a much different problem on your hands, right? You've got a child that's super wound up, that's probably dehydrated from the crying and the puking, right? And now you're up all night.
Yeah. Yeah.
Right. So it's really about prepping before, understanding kind of the rules or guidelines, and then just following a decent set of rules, but knowing when to, go in and help.
Again, amazing information. I think I just want to differentiate here that what you're talking about is like, don't jump in to physically grab them, soothe them. If the goal is you still want them to sleep.
Correct.
If they're waking up and getting fussy and kind of all the things you were talking about and like nap time is over, sleep is over, then go in.
Grab them, pull them, do the whole thing. Yeah, I'm talking middle of the night.
Okay. That highlights something now that we researched and it's been working really well, and that's waiting to put them into the bassinet or the cradle or whatever it is. New dad brain, still not firing here, is in their transition. So you don't want them fully asleep, but if they're getting like sleepy and beginning to like close their eyes a little bit more,
as soon as they start to rub their eyes, start putting them down.
Okay.
So when they do this, that is them basically saying, I'm tired.
My son, he hasn't done this quite that much, but
you'll figure out what his sign is.
Nuzzle, he'll rub his face in his head.
Yeah, you find the sign.
Yeah.
Because every kid's a little bit different. Both of my kids were eye rubbers. So we knew. I have a 23-year-old and a 21-year-old. So I've been through this on a couple of occasions, and I treat a lot of patients like this as well.
Amazing. Okay. All right. I'll get off my new parent soapbox here.
No, it's good stuff.
But I want to ask, because sleep health is huge, right? I think
it's a big deal.
It is. And this is, to your
Who
credit,
knew?
You've been talking about this for a minute.
25 years.
Wow.
I'm old, brother.
I'm curious, in 25 years, as a personal, huge sleep health advocate and professionally, what has been the biggest consistent through line that is accurate? And what is one thing in sleep health that you wish would just go away by now?
Easiest one, wake up at the same time 7 days a week. If every one of your listeners did was do that, I can guarantee a 20 to 30% improvement in their overall sleep quality.
Wow.
Let me explain. At night, your core body temperature rises. And it gets to a point where it reaches a peak and then it drops. That drop is a signal to your brain to release melatonin and allow you to fall asleep, okay? When you wake up in the morning time and your eyes open up, right? Sunlight hits your eye and hits a very specific cell in your eye called a melanopsin cell, sends a signal to your brain to turn the melatonin faucet off in your brain. But it sets a timer for 14 hours later. This is called the melatonin phase response curve. So if you're waking up at 6 a.m., 14 hours later is 8 p.m., melatonin kicks off, takes about 90 minutes for it to get up and in. So around 9:30, you start to feel a little sleepy, get ready for bed. By 10:30, 11 o'clock, you're in bed, okay? Or maybe even earlier. That's at 6 a.m. Now you sleep in on Saturday until 8. Guess what? Melatonin doesn't kick off at 8 p.m. It kicks off at 10 p.m. now.
It doesn't know that you're on a weekend.
It has no idea. It's a timer, not a clock. That's the difference.
Wow.
So it's a static piece of time that you now have to understand how it works in your body. So if you keep your 6 a.m. 7 days a week, your melatonin knows exactly what to do and exactly when to do it. And I've actually fixed more people's sleep with this one tip than any other single tip out there. Period. Full stop.
Man. I mean, I can't disagree. I got to say, probably about 5 years ago, right when I first moved to LA, I really just honed all in on sleep health and prioritizing it.
You should have called. We're neighbors.
I should have gone back to our podcast.
I know, right?
The thing that I did was I did that. Well, I did the same rise time and the same bedtime. And after, honestly, I'd say
so I'll tell
2
you this.
weeks, my life was transformed.
It's amazing. But a lot of people, bedtime is kind of like a bag of chips. Once it's open, it's done.
What do you mean?
Once you blow past your bedtime, most people are like, screw it. Let's just watch Game of Thrones, right? They're like, let's go.
I'm already in.
Right.
Yeah,
I've already passed my bedtime.
Deed, yeah.
Right. I might as well just have a good time here. The reason I focus on the morning time is because you really have total control of what time you wake up. You set an alarm. It's very simple. And it pulls you out of sleep if you're sleeping until your alarm. And by the way, by setting that morning wake up time, you will naturally change your bedtime. You know you're getting up at 6.
Yeah.
You're like, screw it. I'm not staying up until 1.
Quickly,
It does. And now you're starting to think about your sleep more. You're starting to think about, okay, I'm waking up in the morning. What time should I be thinking about going to sleep at night? And when people think about their sleep more, it's better for them. Most people never think about their sleep. They just wait till their head is bobbing in front of the television, and then they walk into the bathroom, they wash their face, they brush their teeth, they get in bed, and then they're wide awake and they don't know what to do.
Nobody does that, right? Nobody does that.
But one piece of advice is wake up at the same time 7 days a week. Now, I'll tell you what I wish would stop. You asked what would stop.
That was going to be my follow-up, yeah.
Yep. I wish that people understood what melatonin really is and understood how to utilize it. Okay, so lots of people take melatonin, right? Melatonin is a hormone. It is not an herb. It is not a mineral. It is not a vitamin. It is a hormone. Hormones affect your entire body in very unique ways. So most people don't know this. Melatonin is by prescription only everywhere but the United States.
Come on, really?
Everywhere but the United States. Okay, that's number one.
I had no idea.
Number two, at high dosages, melatonin is a contraceptive. Yes, it is birth control. Correct. Now, how many pediatricians are walking around telling parents, hey, your kid's not sleeping, give them some melatonin and have them fall asleep? Number one, I think it's 96% of children have got 4 times the amount of melatonin that they really need. So giving them more melatonin is not a good idea, number one. Number two, you just taught your kid they need a pill to sleep. That's a really stupid freaking idea, right? So I'm not a fan. Anybody under the age of 18 should not take melatonin, full stop, unless you have a child on the spectrum. There is data to show that children who are on the autism spectrum actually require melatonin at fairly decent dosages, like 5 to 7 milligrams.
Require, not just might be advised to supplement with, but actually require.
I would say possibly require. I mean, if your child doesn't have a sleep problem, then I wouldn't institute melatonin. But if you've got a child on the spectrum that is having a sleep problem, melatonin is definitely a great place to start. But that is the only group of children where I would say that it's a good idea. Here's the crazy thing that almost nobody knows. Melatonin changes the effectiveness of birth control.
Well, yeah, if it's a contraceptive like you're talking about, yeah.
Right. So every woman who's out there on birth control who's currently taking melatonin, your birth control is far less effective. Wake up.
How many people... I've never heard of this. Why don't people talk about this?
I've got more data. Did you know that melatonin directly affects SSRIs, which are antidepressants? Zoloft, Paxil, Effexor, every single antidepressant on the marketplace is affected by melatonin. That's problematic. Did you know that diabetes medication and high blood pressure medication are all affected by melatonin? There is an interaction effect. So people just willy-nilly walk into the health food store, the Whole Foods, the Lazy Acres, the Erewhon, whatever, and they buy this melatonin off the shelf, which, by the way, is in an overdosage format. The correct dose is somewhere between 0.5 and 1.5 milligrams. It's almost impossible to find. You go into a store and there's 3 milligrams, 5 milligrams, 10 milligrams. So I investigated that to figure out why. So it turns out that there was a guy out of MIT named Dr. Wortman who discovered the exact dose that you need of melatonin to get plasma concentration levels to the point where it's effective. And then he patented the dose.
Oh my God.
And so every company—
this is the dose that's in the products.
This is the dose that it should be, which is between 0.5 and 1.5 milligrams.
Okay.
And so every other group that decided to sell melatonin, we're going to have to pay him for his patent. So they just said, screw it, we'll just double the dose. Who cares what it does to people? And that's why we have melatonin at massively high dosages out there. Now, a study was done out of Canada. This was going back 8-10 years ago, where they pulled 30 different melatonin brands off the shelf. And guess what? None of them had the amount on the bottle that was in it. Half of them were extremely high and half of them were extremely low. So people— buyer beware. Like, you're asking me what's one of the bigger problems in sleep? I would argue that there's a gazillion people out there that are taking melatonin that A, are not taking it the right way, B, not taking the right dose, and C, it's not going to be effective for them.
Where to even begin with that? Well, one, I knew that melatonin was a hormone. I think the vast majority of people don't not.
They have no
They view
idea.
it, if I can go to CVS, over the counter, buy it, especially in a gummy.
It must be safe.
It's a safe, fun little vitamin supplement thing. So one, I think the awareness that melatonin is in fact a hormone. And the second—
Big deal.
Continuously seconds that you start messing around with exogenous hormones, it has massive cascading effects, majority speaking, to what your body endogenously is going to create or stop creating, especially when it comes to melatonin.
It's just like testosterone. There's a reason that you don't go to the CVS and walk into the testosterone aisle and pull some and take it home.
God, LA people would love that if you could.
All the gym bros out there would be into it.
But especially, I think the other thing to point out about hormones, melatonin, is that once you start messing with one, it
messes with all the others.
Yeah.
Yes, exactly. And you've also, once again, told yourself that you need a pill to sleep. Okay. I have been treating patients for 26 years. Are there people that need a pill to sleep? You bet. There are some people that need a pill to sleep. If you're a paranoid schizophrenic, you get your Ambien. No questions asked. Okay. If you're a bipolar, you can get your sleeping pills. No problem. There are certain situations where it makes perfect sense. And by the way, there are even situations where melatonin makes sense. Jet lag. Absolutely, I use melatonin for jet lag. Shift work, of course we use it for there. There's even people who have melatonin deficiencies. Now, here's what's interesting is as we get older, so I'm 57 years old, right around 50, 55, that's when we start to see melatonin production decline.
Is that male and female?
Male and female, right? And so I'm in the range where I can go get myself tested and see if I have a melatonin deficiency. It may make sense for me to personally be taking melatonin at my age. So there's really 3 big situations where I would say melatonin makes perfect sense, and any sleep doctor you brought through this door would say the same thing. The problem comes is when people start going outside of these parameters and using it basically as a placebo, right? Because that's really what's happening. And by the way, placebos are great. Right? Like placebos
there
work
is the placebo effect.
30% of the time placebos work. Like if I could get everybody to work 30% of the time, I'd be fantastic.
But so that also makes me ask, so for someone like, in the age range and you're talking about specifically with, diagnosed mental health disorders, we're talking this is really the only appropriate time to consider melatonin?
Well, I mean, again, depending upon what their sleep issues are. And it doesn't have to be mental health issues. Like, let's say they've got dementia. Let's say they've got Parkinson's. Like, there's a whole host of different reasons why people might have varied melatonin. But at that age, right, where it starts to become deficient, what I'm suggesting is, yes, you can absolutely help that deficiency and then see how the body reacts.
Okay, yeah.
And by the way, that's how I do all my supplements. So people come to me all the time like, Michael, what's the best supplement for sleep? Like, I just want to optimize my sleep. What's the one thing I should take, right? So number one, that's the dumbest question on earth. And I get it every single day.
All right, so I'm just going to delete that
question from your notes, right?
Uh,
So here's my theory, and I think every physician out there would agree with me on this one. Do blood work first. Let's see where your deficiencies are. If you're deficient in vitamin D, magnesium, iron, or melatonin, let's fix that first. Once we get this unit working in terms of deficiencies, it may sleep just fine. I can assure you don't have a deficiency in ashwagandha. Okay? I can assure you, right? So but that's what people think, right? They're like, oh, screw it. I'll just take an ashwagandha melatonin gummy and everything's great. No, you idiot. All you're doing is you're making your situation potentially worse.
But it doesn't, I mean, as someone who loves ashwagandha and uses it,
I'm not saying anything against ashwagandha.
It has a great calming effect.
It does have a great calming effect.
Which can then help calm you down, get you to a place where you can go to sleep.
Right.
But we're not messing with hormones here.
But if you had a magnesium deficiency and a vitamin D deficiency, and you added ashwagandha on top of that, it doesn't change your vitamin D deficiency and your magnesium deficiency, which, by the way, affects a whole shitload of other things that are going on in your body besides sleep.
Yes. Yeah, I mean, magnesium has what
300,
we know, hundreds,
like 300 different things it affects.
It's a catalyst for we're still finding out more.
Right, and by the way, you have to eat your magnesium. Your body doesn't produce it. And most of the food that we would go to get magnesium from, like leafy greens, like kale and stuff like that, our soil has been so over-tilled that the magnesium isn't coming up through the rootstocks. So you could eat a fucking bushel of kale and still not get enough magnesium. So I have almost all of my patients are supplementing with magnesium. Almost all of my patients supplement with vitamin D because we know that they've got these deficiencies. You'd be shocked at how many people I fix just by doing those two things.
Magnesium does wonders. As someone, again, who supplements nightly with magnesium.
I do mine in the mornings. People always ask, like, what time do you take your magnesium? Does it make you sleepy? No, it doesn't make me sleepy.
It doesn't make me sleepy either, but I found this is how, and please correct me if I'm wrong.
I will.
One kind of
Don't you worry.
Respect. One kind of telltale way that I feel like magnesium works better for me for improved sleep health is when I supplement with magnesium, I will notice that I can recall into greater detail dreams. And we dream more in REM sleep, right? Dreams. So is that?
Well, yes and no. So 80% of the time, if I wake somebody up in REM sleep, they'll report a dream. But about 20% of the time, if I wake somebody up in any other stage of sleep, they will also report a dream. So you dream in every stage of sleep. You're just more likely to be dreaming in REM sleep. Okay, so that's number one. Now, dreams in and of themselves are a fascinating field of study. I just spent the last year becoming what's called a dream therapist. Now, let me explain to you what this is because it's not dream interpretation.
So you're like interpreting our dreams, like
no, I am
buy
not.
a lotto ticket, break up with your boyfriend.
No, I am not. Okay. I am not doing any of that. What we do is we use the dream as part of the therapeutic process. So as an example, you come to see me and you're having these dreams. I would bring you into a room with me, not too dissimilar from where we are now. I'd put you into a mild hypnotic state merely by doing some breath work, just, nostril breathing for a few minutes, just to relax you and calm you down. Before you would have arrived, I would have asked you to write down the dream in as much detail as you could possibly remember. Okay. And then with your eyes closed in a relaxed state, I would ask you to repeat to me your dream. And when we got to the end of where you remembered, I would basically just turn to you and say, push play. What happens next? I already have you in a very suggestive state. I have you in a state where you're able to recall. Remember, dreams are 85% imagination and 15% fact. Okay, most people don't know that. So,
how do we know that?
When we actually have people write dream reports,
interpret the data,
right? We look at the report and we say what's real, what's not real. Again, 85% of it is imagination. So what's good about that for us is we allow the person to continue to imagine what happens. So what do I do in this particular situation? I'm a Sherpa. I'm not an interpreter. So I say, let's drop into the dream together. So in her mind, she has now dropped us into the dream. I'm using her as a patient, okay? We dropped into the dream. And then I turn to her and I say, well, describe to me the setting. And I'll give you an example. The patient I was working with not too long ago, and she said, well, we're in a jungle. I said, oh, that's cool. I said, are there any animals in the jungle? And she looks around and she's quiet for a second, her eyes, and I can see her head, rotating.
Like literally scanning the jungle.
She's scanning the jungle in her head. And she said, absolutely, there's a lion over there. And I said, oh my gosh. I said, well, is the lion friendly? She stops. Yeah, the lion is friendly. Okay. Does the lion speak? Yeah, Michael, the lion speak. Can we walk over and talk to the lion? I'm just asking questions. Prompting, right? Again, I don't know what the lion represents or doesn't represent. I'm here to merely have you, the dreamer, push us through the dream from the point in which you stopped so we can figure out what's going on. Because it doesn't matter what I think the dream means. It only matters what you think the dream means.
This is where everyone listening is screaming, yeah, it's called Inception. I love the movie. It was great.
So it's not too dissimilar. I'll tell you a separate story about Inception that's very interesting. But let's get back to the dream that we're working with this person on. So we walk over to the lion. And so I say, the lion talks. Does the lion have a name? And she says, yeah, the lion's name is Leonard. I said, that's an interesting name for a lion. Why is his name Leonard? And then all of a sudden it comes out, my father's name is Leonard. Now we're someplace.
Interesting.
And that's how it works.
Well, I've never heard of this before. This is amazing.
Very few people have heard about it. It's you have to get trained by like a special group of people. Like it's a whole thing. But there is a well-documented way of studying and learning how to do dream therapy. I literally spent a year I was in a class. We had other people and we would work with each other's dreams and we did the whole thing. And it was fascinating. So absolutely fascinating.
Where does it go from there? So like you kind of both realize my father is the lion. So then what? She's like, I want to reach out to my father? Or?
Well, no. So then we started talking to the lion. And guess what? The lion had a problem with her. And it kind of mimicked the relationship that she has with her father. And as she was talking with the lion, she was realizing some of the problems that she was having with her father. And when I pulled her back out of the dream, and at that point, when you pull somebody back out, they've had quite an experience. So you again, keep them safe, keep them calm, make sure that they're all good. Mm-hmm. And then you just turn to them and say, well, what did you think? And the person now assimilates all of that imagined experience to now say what it means to them. Because that's all that matters.
Yeah. Wow, this kind of reminds me of...
It's so cool, dude.
Reminds me of ketamine-assisted psychotherapy.
It's very similar.
Not going fully in, but like,
you don't have to use the ketamine part of it. But it's not too dissimilar from a Sherpa type of, you've got a guide, right? Ashwagandha. No, not ashwagandha. What is it? Ayahuasca. People do guided ayahuasca trips and things like that. It's not too dissimilar from that. However, I don't need a drug to do it. All you have to do is have had a dream and write it down.
But here's the catch. Most people are like, well, I don't remember my dreams, so we need to fix your sleep to get them to this point.
Yes and no. I can teach you how to remember your dreams, but to be clear, it's one of those skill sets where once you turn it on, it's not that easy to turn it off. So
what do you mean?
Well, once you start remembering your dreams and I show you how to remember your dreams, then you remember all of your dreams.
Not just like I get better at remembering them, but every dream that I've had, I learn how to unlock it.
You can't unlock past dreams, but moving forward, now you start to remember all your dreams. To be clear, you don't necessarily want to remember all your dreams. There's some weird shit that goes on in your dreams that can have a pretty big effect on you during the day. Think about it whenever you've had a scary dream or a surprising dream or something like that, or you woke up and you're like, did that really happen? Like that has an effect on people. So I'm always when I work with people, I'm like, hey, if you come to me with a disturbing dream or a stress dream or a frequency dream, then let's work with it. But I'm not really big on, hey, let's crack open the dream in your head and see what's going on, unless the patient comes to me and says, hey, that's what I want to do. Then I feel comfortable that I can do it in a safe environment where they don't get hurt, where there's not any major problems. And where we do a lot of this work, believe it or not, is with nightmares and with people with PTSD. So think about PTSD for a second. Like one of the hallmark symptoms of PTSD is nightmares. So when we've got people who, for example, were in an active theater of war, and they come back and their head had to be on a swivel and they had to make sure that they were alive, those people don't fucking sleep, okay? And there's a reason that they don't sleep is because not sleeping kept them alive. And some pretty terrible things happened to them while they were over there. And so they've got these nightmares. What we know about nightmares, well, let me back up for a second. Dreams are emotional metabolism. Okay? Dreams help you work through whatever emotions you had that day. The reason that you have a dream every single night, which most of the time you don't remember, is based on the emotions that you had during the day and being able to process them. The reason we know this is because what nightmares are is the opposite. What nightmares are is you're having this dream and it becomes so scary and you cannot process the information, you wake up. That is officially a nightmare. You have to wake up from sleep in a panicked state or a frightened state for it to qualify as a nightmare. That's what almost everybody with PTSD has. And so what we do, here's the coolest part about the whole thing, is when we have people write down their dream, at the very end, we have them change the ending. So instead of somebody coming at you, they're going to kill you or stab you or whatever, you become the victor, not the victim.
Oh, wow.
And you change the end of the dream in your writings. And then we have you repeat the dream before bed. And within 5 to 7 days, you change the dream.
This is fascinating.
It's so cool.
This is pioneering medicine, sleep health, mental health, emotional health.
It's cool shit.
Wow.
And I just spent the last year learning more about this and trying to understand how it works because I've done traditional sleep medicine. Mm-hmm. And by the way, just for your audience members, in case you didn't listen to episode 24 where I was before, I have a very unique background, right? So I have a PhD in clinical psychology. I am not an MD. However, I did take the medical boards without going to medical school and passed. I'm one of 168 people in the world who have ever done it. So
humble brag, we like it. All right. That's extremely impressive.
Well, it's not about being impressive. It's about you understanding the context in which I'm giving you information. So while I'm only a PhD in clinical psychology, my goal was to understand insomnia as best I could. You can't understand insomnia if you don't understand the biology. So I was like, well, fuck it. I don't feel like going to medical school. So I'll just take their damn test and learn all the information and then I can do it. And that's pretty much exactly what I did.
That's probably one of the most badass things I've ever heard in the healthcare system. It's like the opposite of, I know quite a few people who go through med school, go through the whole process thinking that's what they want to do, only to realize how little to no impact they can have in the healthcare system, and then it drives them out.
Yeah, I did the opposite.
I have a friend literally right now. She's about to graduate Stanford Med School.
Great school.
She has been after med school for years and years and years, ever since I've known her. And she is not continuing because she realized how much the healthcare system is just so broken.
It's a mess.
Even with her decade plus dream of becoming a doctor, she's like, this is so futile. So
I bypassed all of that.
All to her hands.
I took the shortcut.
Yeah, that's incredible. I didn't know that about you. Wow. God, the time is just flying by. This is so good. One other question around dreams.
Sure.
So if we don't remember our dreams or we don't think that we're dreaming, does that mean we're not getting quality sleep?
No, and that's a common misconception, okay? When you wake up, if you feel good, you got good sleep.
Regardless if we remember a dream or not.
Whether you remember a dream or you don't remember a dream. And by the way, there's a little bit of leeway there. Give yourself about 90 seconds to 2 minutes to wake up because, clear the cobwebs type of thing. But however you feel when you wake up is really a pretty good proxy for how well you slept. I tell people all the time, your aura ring is not you, right? You are your best doctor. You know exactly what's going on with that body better than any other human on earth. And so paying attention becomes critically important. And paying attention in a positive way, not looking for the little problems like, oh, I didn't get enough deep sleep. No, I woke up this morning. How did I feel? I felt pretty good. Excellent. You probably got good sleep.
Yeah, I cannot agree more. I think as much as a lot of people, we really love our wearables and our data and all this stuff, and it has a place, a time and a place. But I think for most people, leaning on qualitative data, meaning just how you feel in your own body, especially when it comes to sleep, is the prime needle mover.
Yeah. Sleep is a perception.
Exactly.
When you wake up, you perceive how well you slept. That's probably pretty close.
Do I feel like shit or do I feel rested?
Exactly.
Do I need to take that information and how I feel and then look at a wearable or a piece of data to potentially ruin it?
Right. Or by the way, so many people tell me that, their wearable hijacked their day. Right? I woke up this morning, I looked at my sleep score, it said I had a 45. I felt pretty good. Now I feel like dog shit. That's not fun.
Yeah.
That's not the way people need to do it. Again, look at your data once a week. Look at trends.
Yes.
Look at when there's a variation. Don't worry about the steady state. The steady state is good.
It's kind of like
relax.
Like the stock market, right? If we just honed in every day looking at portfolios or like ups and downs, you would go crazy.
You would go crazy.
But it's all about the trends.
Exactly. It's all about
that is not financial advice. I have hardly anything in my portfolio. I just let other people do it.
That's the way to do it, brother.
Okay, so some other areas I know that you talk a lot about that I think are very pertinent is, there we go, grammar chase. So many people wake up, they go to sleep, but they wake up. They wake up in the middle of the night and they struggle to get back to sleep.
Number one question that I get.
How do I get back to sleep?
Number one question. So I have a video on this on YouTube. So I will let people know what I'm going to describe now. They'll be able to also find it on YouTube. So if you go to my YouTube channel, which is just The Sleep Doctor, my most popular video, I think it's almost 5 million views.
4.9 million views.
There we go.
Now,
4.9 million views on how to get back to sleep. So let me explain. So if you remember, I was talking earlier, your core body temperature rises, and hits a peak around 10:30 at night. Once your core body temperature drops, it's a signal to your brain to release melatonin. Melatonin is the key that starts the engine for sleep, so you're good to go. Now your core body temperature continues to drop. At some point in time, the internal furnace has got to kick into gear. Otherwise, you go hypothermic and you die. Okay? Guess what time that usually is?
2 a.m., 3 a.m.
Exactly. Between 1 and 3, every human on earth, every one of you guys, every one of you wakes up sometime between 1 and 3 o'clock in the morning. Okay? But here's what happens. Most people roll over, they fart, they burp, and they go back to sleep, right? But there's a group of people, and this is not the case. And those people are having a really rough ride, right? And then this is not, again, uncommon. This is the most popular question that I get asked. So let's break it down for those folks who are stuck in the middle of the night and can't go back to sleep. Step number 1, don't pee. Now, you might be saying to yourself, wait a second, Michael.
Yeah, I'm already up. Why wouldn't I?
That's why.
So I don't have to go get up again.
No. So the main metric that nobody knows is in order to enter into a state of unconsciousness, you need a heart rate of 60 or below.
Makes
okay.
sense.
So what do you think happens to your heart rate when you go from a lying position to a seated position to a standing position and you walk across the room?
You're jumping up.
Your heart rate is already through the roof. So if you don't actually have to pee, don't go pee. Now, I want to be clear. If you think like the flood is coming, please get up, get your ass up and go to the bathroom. But here's what happens is 74% of people are side sleepers. And when you're a side sleeper, you have a tendency to kind of curl up almost into the fetal position.
Putting pressure on your bladder, right?
That's right.
Yeah.
So what do you do when you wake up? If all you do is roll to your back and count to 10 and breathe, you may be very surprised that you don't need to pee. If you don't need to pee, don't get up and pee because you're just making your life more difficult. Number 2, don't look at the clock.
Oh,
now,
yeah.
Here's the problem. As soon as you look at the clock, you instantly do the mental math, and now you're pissed, right? And your heart rate goes up. Shit, it's 3 o'clock in the morning. Here I am again. Sleep. And you try to force yourself to sleep. Chase, in the history of time, nobody has been able to force themselves to sleep. Yeah. It just doesn't work that way. Your energy is not going in the right direction. When you're forcing, your energy is going up. We need you to transition your energy down. Okay? Don't look at the fucking clock if you possibly cannot look at the clock. Now, here's what happens is people say, well, I have to have my phone next to my bed in case my kid calls. And when I wake up in the middle of the night, I just look at the phone and I don't even mean to. Bullshit. Okay? Here's the first thing. When's the last time your kid called in the middle of the night?
Yeah.
Never.
Yeah.
Never. And I'm not suggesting that you put the phone in a different part of the house. I'm just saying put it across the room. Stick it in your bathroom. Okay? Like you can still hear it. I can assure you. And then you don't have that, that reaction where you grab it and then all of a sudden you've looked at the time. Because once you've seen the time, you can't stop the calculation. You can't stop the calculation. Okay, so you haven't peed and you haven't looked at the clock. But to be fair, I'm not so stupid. Like everybody pees and everybody looks at the clock. So now you're back in bed. The only goal that you have is to get your heart rate down. But here's what happens. My wife calls it monkey mind. You just start thinking, oh, I wonder what I'm doing tomorrow. I've got on the schedule. Oh, I forgot to do this today.
You don't even really try. It just kind of naturally happens.
Just starts going. Starts going and going and going. So I have a technique that works like a charm that everybody should do. It's called 4-7-8 breathing. Want to be clear? I did not come up with 4-7-8 breathing. A really smart guy named Dr. Andrew Weil came up with it, and he did it supposedly for the Navy SEALs. So supposedly when Navy SEALs are shooting downrange, if your heart's beating too fast, you can change the trajectory of the bullet. So he had to do this 4-7-8 breathing to drop them down to a heart rate of 60 or below so they could fire in between heartbeats. 60 is our magic number, so we're happy with that.
That's the way we were. I'm former Army, so we were always trained, like basic rifle marksmanship. It's always exhale, pop, squeeze the trigger.
Right.
Yeah.
Exactly. But you've got to have you've got to have enough of a heartbeat.
It all comes down to breathing.
Exactly. Right. So does sleep. It's the same thing. Now, getting people to do 4-7-8 breathing, there's a couple of different factors to talk about there. So number one, breathe in slowly for a count of 4 through your nose, hold for a count of 7, breathe out through your mouth for a count of 8. Now, I'm going to be honest with you. I couldn't do it when I first tried it.
Yeah, it's
hard.
kind of prolonged.
Well, the push at the end is really hard. Yeah. The holding wasn't bad, but once I felt like, oh my God, I'm going to explode. That's not slowing my heart rate down.
Right, yeah.
So what I started with 4, 5, 6 breathing. So breathe in for a count of 4, hold for a count of 5, push for a count of 6. Do that for 2 weeks, then move yourself to 4, 7, 8 breathing. So give yourself some time to get used to the process, okay? So that's number one. Number two, it takes between 15 and 20 cycles of 4, 7, 8 to drop your heart rate. It's not just gonna happen off of 2 or 3 cycles. So how do you count?
Yes.
Right. It became problematic for me. So I'm trying this. I try every technique that I ask my patients to try because sometimes I don't sleep either, right? And so here's what I discovered is if I make a light fist and keep it down by my sides, when I do one cycle, I stick out a finger. Then I do another cycle, I stick it. By the time I've done 10 cycles, then I walk myself backwards. I never make it back to 20.
Wow. Interesting.
And I fall back asleep. And here's the best part.
Yeah.
Here's the best part. You're counting so you can't think.
Turns off the monkey mind.
It does.
Yeah.
So you're doing a hack. You're doing a double. You're distracting your brain and you're doing something to lower your heart rate both at the same time. This is incredibly powerful. And by the way, it's not called ambient. It's called 4, 7, 8 breathing.
Good old breath work does wonders for so many things.
So let's say you've not gone to the bathroom. You did look at the clock. Now you're doing your 4, 7, 8 breathing. You've gone through your 20 cycles. You're still not asleep. What do? Well, you have to assess yourself at this point and decide, am I getting pissed off or am I still pretty chill? If you're getting pissed off, get out of bed.
Really?
Yeah, absolutely. Because look, at the end of the day, if you're just getting angry with yourself, you're certainly not going to let your heart rate go down. However, what I want you to do is I want you to have a spot in the house that's already designated for this particular issue. You've got a chair, you've got a lamp next to it, you've got a book there waiting for you in case this happens. So you get out of your bed, you go right to your spot, you relax, you read quietly, and when your eyelids start to get heavy, now you can come back into bed.
Okay.
Or go to the guest room. Some people find that if they just change rooms because their bed partner was snoring or there's a bulldog in the bed or what, I have 2 bulldogs in my bed, so that's why I say that. So again, understand where your environment will allow you to go, right? Okay, I left, I came back, I did my 4, 7, 8 again, Michael, and I'm still not sleeping. What do? So there's something called non-sleep deep rest. That's also known as yoga nidra. Okay.
Yeah.
So lying in a corpse pose in bed while it's quiet and dark, it turns out it's rejuvenative. It's not as good as sleep, but you do that for an hour, it's worth like 20 minutes of sleep.
Is it something about the position of the hands? Like
I don't know if it's the position of the hands. I think you can put your hands down by your sides, but I've always done it like this.
So for those not watching the video, kind of bringing your arms up across your chest, like crisscross.
Yeah, it's called a corpse pose.
Right, yeah.
Right? But that's what I usually tell my patients to do. And again, if you can just sit there and relax, the natural sleep process will take over and allow you to fall back asleep, right? Now, the final step in this entire process is called acceptance, okay? To be clear, you've been here before. You were probably here last night and your head didn't fucking pop off and the world didn't come to an end, right?
But we can't process it. Don't think that in the moment.
But you can over time, is you can remind yourself over time, oh, I'm here again. I was listening to Chase and that weird sleep guy, and he said, you know what? If you just chill and relax, you're probably doing yourself some good. And so as you do that and as you accept it, it becomes less important. And as it becomes less important, your heart rate goes down. It's all about your heart rate, right? I went to a event last week where I was speaking, and there was another speaker there. His name is Brian Johnson.
Yeah,
right?
the nitric oxide guy. No. The crazy wild air quote here, biohacker, crazy guy.
Right, the don't die guy, right? And so Brian got up there, interesting fellow. I've met him a few times, and he's my biggest cheerleader because all he says is sleep is the most important thing you can possibly do, right? And by the way, he's kind of right. You know, he does things a little bit differently though. Like he looks at sleep from a very different angle than necessarily I do. So he talks a lot about finding a nighttime routine and finding a bedtime. He doesn't really ever mention, hey, what happens if you have a sleep disorder, right? So let's double tap on that for a half a second. If any of your listeners out there or viewers out there think, hey, I could have a sleep disorder. Here's the good news. It's super easy to get tested and it's super cheap now. Before COVID, we used to send people to laboratories. You'd have 27 electrodes on your head. You'd be there all night. It was a weird environment.
I've done
There's
that
a camera
before.
on you.
It's a really unpleasant
bizarre
experience. Yeah.
It's not painful per se, but it's weird.
Yeah.
Now it's all done with a ring or it's done with a device that attaches to your wrist that's full nighttime polysomnography. I can send a sleep study to your home. Like, so the way we do it on my website, thesleepdoctor.com, is if you want a sleep study, you push a button, you go to a calendar, you select a time, you meet with one of our doctors. We've got doctors who are board certified in all 50 states, and they assess you. And then if you need it, they push a button, and guess what? A sleep study comes to your house within 24 to 48 hours. You wear it, and the data jumps to your phone, ports to the cloud. 24 hours after the study, you're meeting with your doctor again. From your home or from your phone if you want, and getting the results and getting your treatment and moving forward. So all of this is to say, like we've been talking about a lot of different aspects of sleep, but to be clear, if you think you have a sleep disorder, now is the time to get it tested. It's and by the way, this whole process, $200.
That's incredible.
$200
from the comfort of your own home.
Yeah. And by the way, insurance might even cover that.
Yeah. HSA, FSA, maybe.
For sure, HSA, FSA, but even some insurances are accepting this now because what we've done is the technology has shrunk the time, right? And now we can score it quicker and we can deliver information faster. So since COVID, there's no excuse not to get I mean, it's $200. I get it. $200 is a decent amount of money, but if you want to figure out one of the main pillars of your health, I suggest you get a sleep study.
Yeah, I mean, what's that worth to you over time? What's $200 now versus how much time, potentially resources, money are you losing?
Dude, $200 is your bar tab on Friday night.
Which we won't even, I'm not gonna have time to get into like the whole aspect of alcohol and sleep. Let's just, wrap it up and just say, if you drink alcohol, your sleep will significantly suffer, no?
Yes. However, there are ways to go about doing it where you don't completely destroy your sleep. I want to be very, very clear. Alcohol is just about the worst thing that you can do to your sleep, specifically your deep sleep, your stage 3-4 sleep, which is called delta sleep. This is your physical restoration sleep. It basically annihilates that, okay? Also, during that particular period of time, something called the glymphatic system kicks in. This is like a waste management system for the brain. It removes proteins that you don't want collecting in there. Alcohol suspends that system. Okay. So, and by the way, before you fall asleep, alcohol is metabolized. One drink takes about 1 hour. Once you fall asleep, that number turns into about 2.5 to 3 hours.
2.5 to 3x?
Right. So not that you would admit to this, but maybe back in the day, did you ever get so hammered one night that you woke up drunk? I have. Right?
Yes.
Right?
Yes.
That's because you go to bed, it's 2:00 in the morning, you've had way too much to drink, your body can't metabolize it, you wake up, you're still drunk. So again, there's a big difference between going to sleep and passing out. Right? So if you wanted to enjoy a glass of wine with your meal, but you don't want to destroy your sleep, how do you do it? It's easy. Do it earlier in the day. Yes, I am promoting day drinking here, okay? Right? Not really, but kind of, sort of, right?
As you get older, man, if you're going to drink, honestly, day drinking becomes your new friend.
Absolutely. Yeah. Well, number one, your body doesn't create something called alcohol dehydrogenase, so you get a better buzz longer because your body isn't creating the enzyme. And by the way, it's cheaper because you don't need as much alcohol. But what I tell people to do is, let's say it's 6:30 and you're sitting down for dinner, or 7 o'clock and you're sitting down for dinner. Have your glass of wine, right? Then have a glass of water. Then have your second glass of wine. Maybe you're halfway through your meal. Then have a glass of water. Now stop. You've put enough water in your system where we're going to start flushing it through. You're still going to feel pretty good enjoying your wine. Now you should have 3 hours before lights out. So 1 hour for each alcoholic beverage plus 1 extra hour just to give yourself a little bit of leeway. So if you're done by 7:30 and you're not going to bed until 10:30, you're fine.
Yeah.
Now, to be clear, if you didn't have any alcohol, would you sleep better? Of course you would. But if you want to have a glass of red wine with dinner, I don't think I give a shit.
Yeah, I'm with you. That's been another great hack I've noticed, personally speaking, ways that I have found to improve my sleep. And honestly, body composition, weight management, digestion, just me personally, again, qualitatively how I feel, especially after waking up, is you could call it intermittent fasting. I don't really abide by that, but like increasing the window of my last mealtime to bedtime.
Yes.
If I can cut off eating by 8 p.m. at the latest, I'm in a much better place. And if I'm going to have alcohol, a beer, a glass of wine with a meal, I'll have it before dinner, or like, up to eating with it or drinking with it.
Which is smart.
And then cut it off even sooner by like 6:37.
Yeah. And this is one of the points that Brian Johnson was making that I agreed with, which I thought was really funny and interesting. So what he does, he stops eating at 11 a.m.
Yeah, he gets it all in the front end of the day, way early.
Right.
Yeah,
and then he has nothing in his stomach. And what he said when I was talking with him afterwards, and he's actually said this publicly, is he said, moving his food timing to 11 a.m. had the largest effect on his sleep than anything else did. And sleep is, in his mind, the most important thing for longevity. I agree.
Wow.
But here's what it's all about: heart rate. So when you eat too close to bedtime, what happens? Your heart has to increase in order to move all the stuff through your metabolism and through your system. And guess what? It takes a while. Depending upon what you eat, it can take hours and hours and hours. So what a lot of people, again, don't think about is, what do you have for dinner?
Yeah.
There are definitely sleep-friendly foods for dinner, and there are definitely sleep non-friendly foods for dinner, right? Like you really don't want to have a massive carbohydrate load before bed. It's very difficult for your body to get through it. Your heart rate is going to be high. You're going to get poor quality sleep on top of all of it. And by the way, you don't have any chance to burn it off. So it's going to fat. So it's really not helping you out to begin with, right? Pasta is great for lunch. And don't get me wrong, every time I've been to Italy, all I do is eat the pasta there.
Of course.
But the pasta there, I think, is a little bit different than the pasta
very
here.
different. I never feel the same way eating pasta.
Me either.
Meal after meal after meal.
When I'm in Europe, you can eat almost anything.
Yeah.
The food here sucks.
Amen,
and
brother.
That has a massive problem when it comes to sleep. And people don't even understand, like they don't even think, well, how could your food have an effect on your sleep? I'm here to tell you it does, for sure.
Do not disagree in any capacity. That could be a whole nother episode. I want to get into.
It might be better if you had me back a little closer than 20 something years.
I already, because I know we're coming up on time here shortly. I'm getting to maybe a quarter of these questions. This is so fascinating. So absolutely, we'd love to have you back again. Sure. I do want to get to specifically where I think we are with, a lot of access to actual tools, products, services, and information about them. I believe that our awareness of tools and sleep health has radically improved over the last few years. And so I want to really highlight, as we get towards the end here, what I'm going to call some common nightstand sleep tools or bedroom sleep tools that I think a lot of us have or are beginning to implement.
I'll give you the thumbs up or the thumbs down.
Let's do it. So kind of maybe like rapid fire style.
Sure, let's go.
In terms of how directly do you think these positively influence our sleep health, generally speaking? Blackout eye mask.
So I'm a huge fan of eye masks. I really enjoy them. I use one personally, and I especially use it when I travel. The big problem with travel is you just never know what the light source is going to be. You never know what's going to happen. So I actually bring earplugs and eye masks with me when I travel. And my wife sleeps with the television on, and we have 2 bulldogs, one of them whom snores. So I sleep with an eye mask on at home.
Well, that brings me to another option or another item is earplugs.
So I'm a fan of earplugs if you can sleep with them. Some people just, if they're side sleepers, they can't sleep with them. I don't have a problem with earplugs in general. However, you want to get them noise level rated at 32 or below. If it's above 32, you can't hear the smoke alarm.
That's, wow. I wasn't even sure where you're going to go with that.
I know you weren't. That's why when I said it, I was looking at you and you were like, what?
So actually, to sidetrack my own story here, one of the only things I haven't done, a tool to improve my sleep health or try or use earplugs. And I actually, I have some coming that I'm testing out as a potential partnership, total honesty. But I want to look up and see. I'm going to link this brand in the show notes for you guys below to check out. But I think, what were you saying, that it needs to be a certain frequency?
They need to be a noise level rated NLR. 32 or below. And anyone...
These 27, it says 27 decibels SNR of noise reduction.
Perfect.
Okay, perfect.
Right. So that you just don't want it to be greater than 32 because then you cannot hear the smoke alarm.
Excellent.
And that becomes problematic.
Yeah, you'll have a great night's sleep, but it'll be your forever
you'll be dead.
sleep. Yeah, your forever sleep.
The dirt nap.
Yeah. So kind of on that cusp, blackout curtains.
So I like blackout curtains. However, the room's so damn dark in the morning, it's hard for me to wake up.
That's my struggle.
Yep. So there are actually companies now that make these specialized curtains that have little motors on them, and they can run by your Alexa. So you can say, Alexa, open my curtains, and it'll open them up.
Or even like time.
And they can be timed and all that kind of stuff. Yeah, I just found a brand called U Blockout, like the letter U and then Blockout, and I'm testing those now.
Okay, interesting. So blackout curtains, great to help you fall asleep, but
Tough
you're
to wake
missing
up
that
in.
morning.
Tough to wake
sunlight
up.
Okay. Something that I've sworn by for the last 2 years: mouth tape.
So pros and cons of mouth tape. So I'm going to get on my soapbox on mouth tape for just a half a second. So everybody out there, here's the reason why most people need mouth tape is congestion. So what happens is you get nasal congestion. 94% of people, when they fall asleep, their mouth will close immediately and it'll stay closed. But if you have nasal congestion, your mouth drops wide open. Here's the problem with breathing air through your mouth. It's like putting leaded gas in the car. There's no filter. It doesn't warm it. Your nose has little hairs called cilia, which pulls out particulates. It moistens the air. It warms the air. It makes it much easier for your lungs to take it in and to utilize the componentry in it versus this basically raw air that comes through your mouth. So you should keep your mouth shut. Here's the problem with mouth tape is it masks sleep apnea. So what I tell every single one of my patients in every podcast that I'm on, because everybody asks about it, don't use mouth tape unless you've done a sleep study. If you don't know, if you have mild sleep apnea and you don't know it, and that's the reason that you're breathing through your mouth and all you're doing is taping your mouth, your apnea is just going to get worse. And you're going to have more complications from it over the course of time. And eventually it'll get so bad that you'll pop the tape off in the middle of the night trying to breathe. All I'm saying is go get one of our $200 tests to figure out if you've got sleep apnea or not. If you don't, tape to your heart's content. However, most people do it wrong. Most people use a horizontal piece. That's stupid. It's a small vertical piece. It goes straight down through the middle. And by the way, you don't have to buy some fancy schmancy brand. If you go to CVS, go into the first aid section, look for something called 3M micropore tape. We use it in surgery. It's like a skin tape. We just use it to pull the skin to the side to be able to open up, if you're doing sutures or something like that. So it's really quite simple. Also, I'll be honest with you. There are some brands out there that have got terrible names for their mouth tape. There's a brand out there.
Hostage tape. I call it all the time. I think it's the worst name ever.
I can't think of a bigger insult to the people who are currently still being held as hostages than a brand doing something like this. I think it's in incredible poor taste.
I think it's very insensitive.
And by the way, it's not like that brand does anything super fantastic.
I don't use that brand. Not for that title, but I do think it's a horrible name personally.
It's an awful name.
Okay, great. So let's move on to a couple other things. Noise machine, white noise machine, brown noise machine.
I love noise machines. However, if you get too used to them, you better make sure you can take that thing with you wherever you want, especially with kids. So a lot of parents, they'll take a sound machine and they'll put it into their room because they're rummaging around the house and they don't want to wake the baby. Bad idea. Wake the baby. What we used to do is when the baby was taking a nap, we would vacuum in the baby's room while the baby was napping. You want your kid to be able to sleep through the noise.
Wow. Yeah, Dean, the louder it is, the better.
Right.
He sleeps through everything.
It's perfect. That's exactly what you want. Now, can noise machines be helpful? Of course they can. Look, my wife falls asleep with the television on every single night, and I'm the fucking sleep doctor, okay? There's a big screen TV this big in my bedroom. It's on all night long, okay? So I'll tell you the story. So when my wife and I were dating, which was 27 years ago, she said, if you ever,
amazing, by the way, congratulations.
Thanks.
That's a great, great history.
Yeah. And so she said, if we ever have a sleepover, I need to let you know that I fall asleep with the TV on. And I said, don't you worry about that. I'm going to become a sleep doctor. I'm going to fix that. I don't know if you've ever tried to fix
I was going to
something
say, famous
in one
last
of your
words.
partners.
In my relationship, I'm going to fix that for you.
Never, ever works.
No.
So I pulled the TV out and she said, Michael, if you'd ever like to get in that bed again, I suggest you put the TV back. I put the TV right back in and I decided to study her. And what I discovered is she's not even watching. She's just listening out of what I call the corner of her ear. And it's always an episode of Seinfeld or, something
just
silly.
Friends, background.
Yeah, but it's enough of a distraction for her for monkey mind. So I use 4-7-8 breathing. That's what helps me. She likes the television on. That's what helps her. Like, it doesn't bother me. If it kept me up and bothered me, we'd have an issue, right? But it doesn't. I mean, again, I've been married to her for 27 years. Like I've been doing this for 20. It just doesn't get to me at that point. Now, I also want to talk about another area that's important, which is there are a lot of patients who they can't sleep in the same room with their partner. And I want to be very, very clear here on the pod. That's okay. The strength of your relationship has nothing to do with where you sleep.
But doesn't sleeping with your partner, you get the oxytocin, the serotonin, you get that kind of like
You
bonding.
can have all of that on a schedule whenever you want it. In fact,
But who wants to schedule cuddles?
if you can't sleep at night, you want to schedule cuddles because you have no interest in cuddling if you ain't sleeping at night.
Touché.
You're pissed off and you're not doing well, right? I'd rather you sleep Monday through Thursday in the guest room and then Friday, Saturday, and Sunday have intimacy with your partner and then go back. And guess what? Everybody's happy. Everybody gets their cuddles. Everybody gets their intimacy and everybody gets their sleep.
Interesting. So many great hacks here.
I got a new book out. We should talk about that.
Eat,
sleep, drink, breathe.
Excuse me. Yes. Sleep, drink, breathe. I have one more question about
Fire
these
away.
tools and then we'll get into that.
You bet.
Smart beds.
Yes.
Smart devices. I have a chili pad on my mattress, a mattress topper.
Love chili pad.
They're great. I swear
great.
by it, especially if you like to sleep warmer or colder than your partner. You can segment it. Or things like, 8 sleep mattress, these smart mattresses that are coming out that can measure biomarkers and things like that, but also like control the temperature.
Yes. So those are two different animals. So let's talk about them in two different ways. There's the temperature modulation and then there's the sleep tracker of it all. Okay. So temperature modulation, love it. Especially for my menopausal female patients. There is nothing better than being able to give them a cool bed on which to sleep. So 8 sleep, chili pad. There's several of them out there. I like some better than others. I'll be honest with you. Most of them are kind of expensive. So I've come up with a hack. So if you think that temperature might be a thing for you, here's an easy way to figure it out without spending thousands of dollars. First, go out and buy 2, 12 or 14 ounce water bottles, just regular water bottles, stick them in the freezer and freeze them. Then put them into a tube sock and put one on either side of your hip and go to sleep. You have your own personal air conditioner and you will figure, if you sleep well by doing that, then you know that temperature is one of your things.
Amazing.
And then you can decide, do I want to just keep doing the frozen water bottle thing or do I want to buy a piece of equipment that makes my bed cooler? Because again, they're expensive, but I think they're kind of cool. Now, literally. Now, here's the issue is many of these products claim to be able to measure your sleep.
Yeah, right. Like measure HRV, track sleep and all that stuff.
HRV, they can probably do a decent job of, but actually getting into the phases of sleep, it would be almost impossible for them to have any real level of good accuracy at this point. And I can tell you that most of the sleep trackers out there, the technology is not where we would want it to be. They're not medical devices for sure. So we have to really think through the data that we receive from them. But on the temperature side of things, I think the temperature side is pretty cool. And I would recommend that people, if they're interested, try the frozen bottle technique, and then you can start to look around to see what works.
That's a great hack. I've never thought about that. Taking ice packs or something.
Exactly.
And putting in your bed. I will say, personally, besides committing to the same sleep time and wake time, a blackout eye mask, for me personally, mouth tape, also getting a chili pad, that cooling topper.
Yeah.
It's hard for me to kind of say top 4, but those 4 things all like kind of equally matter to me.
Yeah.
Profound difference in temperature, profound difference in sleep quality, just amazing.
It's remarkable, isn't it?
Yeah, it's incredible. Especially again, if you have a partner like I'm always burning up hot. My wife is always cold. So we got
Which
the one
is
just
very characteristic of male, female. Not all, but we hear this a lot. And some of it has to do with body fat percentage, right? And so a lot of guys have got a little bit more body fat on them, so they're a little bit warmer. A lot of women don't have as much body fat on them, so they're a little bit cooler.
Doc, also more muscle mass too.
not cracking on
burns
you.
high, you know?
I'm not cracking on you in particular.
New dad's got me a little fluffy. I'm not gonna lie, but so I want to wrap things up and get to our before our last question. You have an amazing new book out.
I do.
You do talk so much about these sleep tools and habits
Correct.
and awareness, but also two other key areas that I think a lot of people don't always think to incorporate.
Yes.
So shine a light on the book and the workforce, please.
So the book is called Sleep, Drink, Breathe. Wellness is too fucking complicated, because it is.
Which I love that you dropped the F-bomb in the book title. That's incredible.
Well, I didn't get to, let me tell you, I've been trying to get the subtitle changed. They're giving me a really hard time about it. But here's the deal is so a good friend of mine, his name is Joe Polish, and Joe wrote this book called Life Gives to the Giver. And there was a chapter in there where he talks about these things called dominoes. And so what is a domino? A domino is a skill that you acquire, that once you acquire, it knocks down several other skills that make them unlocks. That's the word you were using earlier. I like that word, unlocks. And so I was reading it and I was like, I wonder what the dominoes of wellness would be, right? And so then I started to think, well, what are the things in wellness that you can't live long without? So air, clearly one of them. The world's record, by the way, for holding your breath is 24 minutes. It's held by one of those deep dive guys. I don't know what that's called. Free diving.
Yes. Yeah.
And he trained for 2 years and he had to fill his lungs with like a special kind of oxygen in order to do it. Kate Winslet, by the way, when she was filming Avatar, she was able to hold her breath for 6.5 minutes.
Titanic.
No, for Avatar.
Kate Winslet's in Avatar?
I think she's in one of them. Was it Kate Winslet? Maybe I'm thinking of the wrong actress.
Zoe Saldana?
Maybe it's Zoe Saldana.
Okay, yeah.
Whoever it was, one of the female actresses from
the
Avatar.
second one's all in water.
Yeah. So whoever that was, I thought it was Kate Winslet, but I could be wrong. Whoever that actress is, she can hold her breath for 6.5 minutes with training.
Wow.
So it's not an impossibility. So air was one thing. But then I started to think, well, what else could there be? Well, you can only go about 2 days without water. So hydration has to be one of them. Mm-hmm. And then I started thinking, well, how long can you go without food? You can go without food almost 30 days, pretty easily. Right? How long can you go without exercise? Well, shit, some people have a lifetime without exercise. So diet and nutrition are probably not in my upper DNA of wellness, right? What was kind of left? Well, my area of expertise, sleep. You can go about 5 days without sleep, but you will lose your mind. Like you will start seeing shit. You don't know who you are. It's a mess.
And I've heard the record, I think, or anymore.
I think it's 11 days.
Anybody who goes more than, I think, 7 days or 9 days without sleeping, everyone dies.
No,
they all die.
So that's not true.
No.
That's not true. So the record, I believe, is held by a guy named Rudy Gardner, and it was 11 days, but it was caffeine assisted. So he was drinking Coca-Colas and playing pinball. This was in the 70s. So this is what he did. Like, I mean, this is, you look back at Guinness World Records. That's where it was. So I was looking at hydration. I was looking at breathing, I was looking at hydration, and I was looking at sleep. Because I said, these are the 3 things that your body's got to do. So then I started getting on podcasts, promoting my book, and people are like, well, why did you write a book about that? Those are the 3 things that our body does naturally, Michael. Right? And so my answer is very simple. We don't do them correctly.
Yeah, no.
If we did them correctly, I wouldn't have to write a fucking book about it. Right? Like at the end of the day, people don't even know how to breathe. And people don't even understand that breath work can turn on your sympathetic nervous system or turn on your parasympathetic nervous system very, very easily. You said you were in the military, right? They teach you breathing to bring you up and breathing to bring you down.
Absolutely.
And it works well. Right? It works very, very well. So that's the breathing part of the book. Hydration got really interesting for me because I was like, I've been a runner for most of my life. I've worked out for most of my life. I've always felt like I'm pretty good on hydration. I always look at the color of my pee, which, by the way, is one of the easiest ways to figure out if you're hydrated or not. It should be clear to very, very light yellow. But
clear and copious.
Yes. But one thing I learned was sip, don't gulp. So let me explain. So when you wake up in the morning and you go out into the kitchen, there's like this square by the sink. It's called a sponge, right? But it's hard as a rock. And you can probably bang nails with that thing, right? And if you open up the faucet all the way, like gulping water, what happens? The water hits it, splashes off. But if you open it up halfway and it hits it, a couple of drops seep in and it starts to expand. And now you have a useful tool. You are that sponge, brother. Okay? Sip, don't gulp. This happens all the time at the gym, right? So I'm at the gym and the person's got their water bottle and they've jammed it under their thing and it gets halfway up and then they and then they put it back in and I'm the asshole who turns to them and it's like, sip, don't gulp. And they're like, I'm just trying to get it in me.
Yeah.
And it's like, it's going through you.
Why?
Absorption rate. If I stick this entire thing of water in me, I can't absorb the whole thing. It takes time. Everything takes time. We're in a society that is moving so fast all the time. And all we really need to do is slow down a little bit. And so sip, don't gulp.
You're blowing my mind and radically changing my morning routine. For years, the first thing I do when I wake up, I go pound water.
Don't sip it.
Pound water.
Yep. So what I would rather you do when you wake up in the morning is sit on the edge of your bed, take 15 deep breaths, okay? Then I want you to grab 15 ounces of water. Then I want you to walk outside, sit in a chair, get 15 minutes of sunshine, and during that 15 minutes, you get 1 ounce per minute.
Wow.
That's how you do it.
I'm so curious. I'm going to try this.
Try it.
And I'm so curious to see the difference because
You'll love it.
I'm one of those guys, I'm always thirsty. I'm always drinking water. I'm at the point now where I don't know if it's just like a habit that I've ingrained to always be drinking water because I'm very active and always hot. But like, is it an electrolyte thing? Is it a hydration thing? Is it a gulping thing? Apparently,
right. So look at the color of your pee, and some people do overhydrate. Like that is a thing that people can do. Some people get so locked and loaded on hydration that they're like, shit, I better just keep hitting the water.
Also, I take creatine. I've been taking 5 grams of creatine every day for probably like 15 years. I'm always trying to be very conscious of that.
That's why you're always thirsty.
Damn. Okay, I have to wrap up. I have to be conscious of your time.
What are you talking about? We could talk for another 3 hours.
I've got my family's in town. I got to go meet him for lunch. And
baby Dean.
I miss you, but I miss him. This has been so incredible. I seriously have dozens, half my questions that we didn't get to. You got to come back on the show. Sure. This has been so profound and just so helpful. I have guests on that highlight unique areas of wellness, of personal, physical, mental, emotional, spiritual well-being to help us move the needle, to help move forward in life, to live a life ever forward, I say.
Okay.
So if I were ever forward, that's the whole premise of the show. Also, it's a shout out to my late father. This was his mantra, his philosophy.
Amazing.
Up until he passed away 20 years ago now, hard to believe. ALS, unfortunately.
That's a rough one.
But very rough. But, he instilled in us this way of living and thinking and viewing the world.
That's
so
cool.
I bring that coupled to, people like yourself here on the show.
That's amazing.
So if I were to ask you, Dr. Michael Breus, what does ever forward mean to you? How do you live a life ever forward?
Oh, it's a great question. I wasn't expecting it. How do I live a life ever
I didn't ask it back in 2017. I didn't bring it to the show.
I don't think I would have remembered anyway. So how do you live a life ever forward? I think the way you live a life ever forward is slowly, not quickly. I think you've gotta enjoy the ride, right? Like just don't be in such a hurry, right? Like sleep, find your time for sleep, find your time for family, find your time for hobbies, find your time for career, right? But there's room for it all. Just move forward slower, not faster. I feel like the world is moving so fast and we're missing the speed of communication is so quick that it would be great because all it does is amp people up and make them anxious and make them nervous. And so slow down, you'll be surprised. And I would also say, get back to the basics.
Could not agree more.
Sleeping, drinking, and breathing.
I'm going to have all of your work, your book, your links, your everything. Our episode 24 linked down in the video description and show notes for everybody. That one we jumped into your previous book, The Power of When.
Correct.
Talking about chronotypes and learning about the type of chronotype you have and the best practices for sleep and your circadian rhythm and all that. It's also an amazing episode, even though it's 8 years old, and I probably was using my microphone wrong. I was very new to podcasting back in the day. But
we had fun.
It's so good to have you back. And if there's one place they can go to connect with you now, where can they go?
So if they're looking for information about me, I have the same moniker everywhere you go. So it's The Sleep Doctor on every social channel. And specifically, my YouTube channel has been one I've been paying a lot of attention to for the last year. So we've got almost 800 videos, including shorts, up on my video.
And I see creeping up to almost 200,000 subscribers.
Yeah, we're right around.
Yeah.
We're almost
Yeah.
reaching the 200,000
see it.
subscribers. We hit 100,000 last January, so we're moving quick, which is great. I'm excited about it. So that's a fun area where you can learn a lot for me. But if you wanted to learn about the sleep test, if you go to thesleepdoctor.com/Dr. Mike, you will go right to a page that just talks all about the sleep testing that I was mentioning before, the $200 test that's really, really cheap, that I really would like everybody to get. Not for me, but for them.
Absolutely. As someone who thinks that he gets good sleep, maybe right now as a new dad, it's not the best time, but someone who has optimized and prioritized sleep for the past 5 years, I've never done a sleep test during that time. I did one years ago when I got out of the military. I thought I had sleep apnea. Came back negative. But I'm going to check it out.
Yeah, absolutely. Yeah. And after you check it out, I'll come back and we'll talk about it on the show.
Yes. All right, guys, check him out. His work is incredible and he'll be back again soon.
Absolutely.
Yeah.